Imagine a simple, widely available drug, cutting the risk of colorectal cancer coming back by half, but only for a specific group of patients. This is exactly what a groundbreaking new study led by researchers at Karolinska Institutet and Karolinska University Hospital in Sweden has revealed. Their randomized clinical trial found that a low dose of aspirin significantly reduces the chance of cancer recurrence after surgery in patients whose tumors carry a particular genetic mutation. Colorectal cancer affects nearly 2 million people globally each year, and sadly, 20 to 40% of these patients develop metastases. This spread of cancer makes treatment far more challenging and drastically worsens the prognosis. While aspirin has long been known for its pain-relieving and anti-inflammatory properties, its potential role in cancer prevention and treatment has been a subject of debate and investigation. Previous observational studies hinted that aspirin might lower the risk of developing certain cancers and could also reduce the likelihood of cancer returning after surgery, especially in colorectal cancer patients whose tumors have mutations in genes involved in the PIK3 signaling pathway. This pathway is crucial because it controls vital cellular functions like growth and division. When mutations disrupt these genes, cells can grow uncontrollably, leading to cancer. However, until now, no randomized clinical trial had definitively proven this connection, leaving the medical community uncertain. To fill this critical knowledge gap, the ALASCCA trial was launched and has now been published in the prestigious New England Journal of Medicine. This extensive study involved over 3,500 patients diagnosed with colon or rectal cancer from 33 hospitals across Sweden, Norway, Denmark, and Finland. Among these patients, about 40% had tumors with a specific mutation in the PIK3 signaling pathway. These individuals were randomly assigned to receive either 160 milligrams of aspirin daily or a placebo for 3 years following their surgery. The results were striking. Patients with the PIK3 mutation who took aspirin experienced a 55% reduction in the risk of cancer recurrence compared to those who received the placebo. This is a remarkable finding that positions aspirin not just as a common medication, but as a potential precision medicine tailored to genetic profiles. This study represents a novel use of aspirin as a precision treatment, explains Anna Martling, the study's lead author and a professor at the Department of Molecular Medicine and Surgery at Karolinska Institutet, as well as a senior consultant surgeon at Karolinska University Hospital. It clearly demonstrates how genetic information can guide personalized therapy, ultimately saving resources and sparing patients unnecessary suffering. But how exactly does aspirin achieve this protective effect against cancer returning? Researchers believe aspirin works through multiple mechanisms simultaneously. It reduces inflammation, which is known to contribute to cancer progression. It inhibits platelet function, which can help prevent cancer cells from spreading, and it directly slows tumor growth. This multi-pronged approach creates an environment that is less hospitable to cancer cells. While the precise molecular details are still being unraveled, the strong biological rationale behind these findings suggests that aspirin's benefits are especially pronounced in patients with specific genetic alterations. This raises an intriguing question. Could other common drugs be repurposed as targeted cancer therapies based on genetic markers? The implications of this study could be far-reaching. Given aspirin's global availability and low cost compared to many modern cancer treatments, incorporating it into treatment guidelines for colorectal cancer could make a significant impact worldwide. One of the biggest advantages is that aspirin is inexpensive and accessible everywhere, says Martling. This could democratize cancer care and improve outcomes on a global scale. The research was supported in part by the Swedish Research Council and the Swedish Cancer Society, underscoring the importance of continued investment in cancer research. But here's where it gets controversial. Should aspirin become a standard part of treatment for all colorectal cancer patients with the PIK3 mutation? Or are there risks and side effects that warrant caution? And what about patients without this mutation? Could aspirin still offer benefits, or might it be ineffective or even harmful? These questions invite lively debate and further investigation. What do you think? Should aspirin be embraced as a precision medicine in colorectal cancer treatment? Or is more evidence needed before changing clinical practice? Share your thoughts and join the conversation below. For those interested in related advances, recent studies have explored smarter ways to activate the immune system against cancer. The role of high-intensity interval training, HIIT, in boosting anti-cancer proteins and slowing breast cancer growth, and whether high-protein supplements can aid cancer recovery. Source: Martling A. et al., 2025. Low-dose aspirin for PI3K altered localized colorectal cancer. New England Journal of Medicine. doi.org/10.1056 NEJMOA 254650. Please remember, while this information is based on rigorous research, it's not medical advice. Always consult a healthcare professional before making any changes to your treatment or medication.